Welcome to DC Hours, the podcast powered by DC Hours Chiropractic Academy. Hosted by Dr. Guy Annunziata, this show delivers cutting-edge insights into the world of chiropractic care, neuroscience, and continuing education. Each episode explores the principles and techniques that define excellence in the field, with interviews, real-world cases, and in-depth discussions that inspire and inform. Whether you're a practicing chiropractor, a student, or a lifelong learner, DC Hours is your trusted source for professional growth and clinical mastery.
Hello, everybody, and welcome to the DC Hours podcast. Today's guest is Dr. James Meschino. He's a doctor of chiropractic, and he holds a master's degree in science with a specialties in human nutrition and biology. He also completed a doctor of naturopathy degree program as a registered orthomolecular health practitioner. He's the author of several books about nutrition, wellness, and anti-aging, and he teaches seminars to corporations and at professional continuing education conferences. He was selected by Dr. Deepak Chopra to be the nutritional medicine consultant for his Beyond Performance Sports program, and he's developed employee wellness programs for various companies in Canada and the United States. He's a chiropractor with a real passion for combining chiropractic care and nutrition to help people heal and stay healthy. He's an associate professor at the Canadian Memorial Chiropractic College, where he taught nutrition and natural medicine courses since 1984. And he's been doing this for decades. He really knows how to break things down in a way that makes sense. And so in today's episode, Chiropractic and Nutrition, an integrative approach to healing, we're going to talk about how these two worlds come together to support better health, prevent disease, and help people feel their best. Dr. Meschino, welcome to the podcast.
Thank you, Dr. Annunziata. Always a pleasure to chat with you.
Yes, it is. I always learn something when we get to talk to one another. So you've decided, or you've dedicated your career to integrating nutrition into chiropractic care. Was there any particular moment or experience that first made you realize that these two disciplines really needed to work together?
Well, I was already a practicing chiropractor for a few years. I had a good background in exercise physiology before that. And a program was made available to the chiropractic profession by the University of Bridgeport, Connecticut, where you can go back to school part-time, earn a master's degree in science with specialties in nutrition and biology. I think it was going through that program over that 2.5 to 3 year period where, I started to understand that, certain ways that you eat and certain nutrients that you're putting in your body could drive biochemical pathways towards certain degenerative diseases or help to reduce the risk of the likelihood of these things developing. And for me, there was, when I was in chiropractic college, there was this holistic model that chiropractic was more than just manipulation and structure and function and manual therapy. And I knew exercise was important. And so in that program, I saw the importance of specific dietary factors that could influence these pathways and help to an individual achieve more optimal well-being and maintain it for a long period of time without, age-related diseases creeping in. So to me, it just became an extension of the chiropractic story. So
and that happened early on in your career, right?
I was in my late 20s, early 30s when I went back to school and did that. Right. And I was so taken by the subject matter that when I finished that program in 1984, I went to the Chiropractic College in Toronto. And I said, I really think I could teach a better nutrition course than the one that I had when I was a student. So they said, well, we'll try you out. And so that, 40 years later, I'm still there.
You must be doing something right.
Yeah. So I don't teach the entire program anymore. I do just 7 sort of key lectures in the second year program. But for many years, I taught, the second and the fourth year course, set all the exams, marked all the assignments. I just felt chiropractors should get a good sense of this while they're still in school, and hopefully it carries into their professional careers.
So I know a lot of chiropractors, and I'm sure you do too, that really just kind of like, they're almost a little dogmatic in their belief systems, in that they just stick to spinal adjustments and they leave nutrition out of the conversation whatsoever. What would you say to those doctors that feel, nutrition is just outside our scope?
I'd say that, the patients are seeing you. If we just even take one simple example, as sort of the bone doctors. Oh, you crack bones, you manipulate bones. Well, bones, bone health itself is very important. I mean, 1 in 4 women over the age of 50 have osteoporosis. 1 in 8 men develop it. So, if you have a fracture, an osteoporotic fracture, say of the hip, your life expectancy just really got shortened out, and your quality of life. And if you have spinal compression fractures from osteoporosis. So the thing is that if the medical profession was doing a great job of this is a very preventable condition, as you know. So why do 1 in 4 women have this problem at age 50 and 1 in 8 men? It's because of lack of education, or a healthcare practitioner not doing 2 really important things: having an intake questionnaire that sees if you meet the inclusion criteria for bone mineral density test. Most medical doctors, some of them are alert to this, and many of them, they get so busy they forget about it. But chiropractors should be on the leading edge of this. They see us as the bone doctors. So does the person need a bone mineral density test? And from day to day, what is their lifestyle and dietary intake giving them the nutrients that they need to support their bone density? And what's their blood level of vitamin D? Is it in the optimal range to help reduce risk of osteoporosis? How can this not be part of the chiropractic conversation? It's just something on such a basic level. Then I would extend that out and say, at age 40, because the body stops making optimal amounts of glucosamine, as an example. Glucosamine is required for chondroitin sulfate, which is the main part of cartilage. A lot of osteoarthritic conditions that chiropractors end up treating could be prevented or managed better if the person was on the right glucosamine formulation after the age of 40, and giving them the right dosage. So these are just some basic things that, to me, should be an extension of chiropractic care. So I would say that those chiropractors are not doing everything that's possible, even in just a small range of just bone density support and joint cartilage support, that should be part of the conversation with the patient. And I think they're missing out on an important part of health and well-being.
I agree wholeheartedly. And I'll share a quick story. I went to Life University, and there was a very strong population of the faculty and the student body that really put us in that box of being, bone or nervous system doctors, and really did not want to talk about nutrition. They didn't want to talk about brain health. They didn't want to talk about anything other than just removing the subluxation. And now I'm 30 years out into practice, and I've come in contact with a lot of the people that I spoke to back then, and their mind has completely shifted. These chiropractors are now understanding how important nutrition is, and educating the public on just living a healthy lifestyle. And that is part of their care plan now. It's so funny how the mindset shifts, from being the young chiropractic student and, all about just bones. And now all of a sudden they're incorporating nutrition and whatnot. And it's nice to see that.
It's easy to get sucked into this dogmatic, principle, a simplistic principle when you're in your early 20s and you're going to chiropractic. Once you get into the real world and you see what happens to people and the health challenges they have, you start to realize that you can be doing so much more to help them maintain their quality of life. And, removing subluxations is very important.
Yeah,
it's not,
it is.
It's not the whole story. It just isn't.
Right. I'm just hoping that, a lot of our younger listeners are just understanding that, just keep that open mind and don't get put into a box like that. But I want to kind of bring it back to, nutrition again. Are there any specific nutrient deficiencies that you consistently see in patients that have, a very common condition that walks into chiropractic is chronic pain, spinal degeneration. Do you see anything specific that could talk just to that? And how do you address those things? I know you mentioned glucosamine already. I was wondering if there's anything else.
Well, when you look at the National Health and Nutrition Examination Surveys of the United States, so every several years, the government sponsors this huge cross-sectional analysis of the dietary well-being of the American population. And every time they publish it, you see that the majority of Americans don't even meet, the acceptable intake levels, the recommended intake levels, as low as they are, of many nutrients from vitamin C, all the B vitamins, iron. So most people are walking around, maybe don't have overt nutritional deficiency, they're not getting scurvy and pellagra, but they do have, for the most part, unless you're taking at least a multivitamin, marginal deficiencies. And so, that factors into just compromised health and well-being, and your brain's going to age faster, your immune system's not going to be as strong. In terms of how it affects spinal conditions and joint things that we see, I think it has to do mostly with bone mineral density. But I think superimposed on that is what happens in the aging process. And also, running out of optimal nutrients like glucosamine, but also as people gain weight over their lifetime, which is a common feature in the Western world, the fat cells are producing inflammatory cytokines, which are really amplifying the inflammatory processes, leading to more joint pain, cartilage erosion, and cartilage destruction. And so there are certain nutrients that can help to, even if the person doesn't lose weight, help suppress some of the inflammatory behavior. Those aren't really nutrient deficiencies. That's just turning to some natural things like curcumin, boswellia, white willow bark extract, ginger, things that can help to suppress the inflammatory process. That would be a nice aid for those individuals in addition to chiropractic care.
You're talking about inflammation, and as you know, I'm big into neurofeedback, and we do brain maps on all our patients. And one of the signs of inflammation, brain inflammation, is a high magnitude of delta brainwaves in the awakened state. And I got to tell you, we're seeing more and more, and I see that more now than I did back in 2006 when I first started doing neurofeedback. It's pretty amazing how much brain inflammation there is. Would you have any suggestion for that type of inflammation in terms of getting someone to reduce that?
Yeah, studies show that there are several nutrients that can cross the blood-brain barrier and suppress brain inflammation. So omega-3 fats are the first thing that's really important because they get converted into anti-inflammatory prostaglandins and cytokines. And also curcumin crosses the blood-brain barrier. And it's been shown to have important neuroprotective effects, including suppressing brain inflammation. And the same is true with some other really sexy nutrients like CDP choline and huperzine A, which I put into a formula for memory support. They can help to reduce brain inflammation and also getting an adequate amount of vitamin B3 in the form of nicotinamide. So we're seeing that the microglia have nicotinamide receptors. And when you stimulate them, the microglia do a much better job of suppressing inflammation and helping to prevent the buildup of beta amyloid plaque linked to Alzheimer's disease.
Oh, wow.
So it was the Rush Institute study out of Chicago that first gave us this hint that people, because we used to think that niacin was needed just to make NAD for ATP production.
Yeah, that's what I learned in school.
Yeah, so you need 15 milligrams a day, and they're saying no, people who are getting 45 to 50 milligrams a day, and they're getting that from a supplement. Well, after like what they did in this Chicago community dwelling study, they said, we can't explain this, but people that are getting 45 to 50 milligrams a day of niacin in the form of nicotinamide, and that's from a supplement, basically. After we control for all other confounding variables, obesity, alcohol consumption, social economic status, all the other things, higher education, everything else that you think is linked to brain health and Alzheimer's risk. After we control for those factors, the single most important factor that showed up, and we can't explain it, they couldn't at that time, is that people that are getting this much niacin are having a much lower likelihood of developing Alzheimer's as they age. So then
Wow.
they started to investigate it, and they saw that that vitamin B3 is required to help with microglia function,
Mm-hmm.
but also it helps the brain make more NAD in the oxidized state. Without getting too technical, NAD in the oxidized state is an important cofactor for enzymes that prevent the tau protein from breaking down and forming neurofibrillary tangles.
Mm.
So there are these what are called histone deacetylase enzymes that remove the acetyl tags from the tau protein. And if they do that in time, the tau doesn't get phosphorylated and break down. So you have to constantly be removing these acetyl tags that are attaching to the tau protein. And as you get older, your brain levels of NAD decline. So making sure you're getting at least 50 milligrams a day of nicotinamide from a high-potency multivitamin is very helpful.
Yeah.
And so now
My wife started just supplementing with that, and she's been on me to do it too.
So now you see different forms of niacin in the marketplace.
Yeah.
They claim can build NAD faster, like NMN and nicotinamide ribose, trying to determine which ones are the best ones to help the brain make NAD. So those are nutrients that are important, to reduce brain inflammation.
So does a chiropractor need to be able to order blood work to bring nutrition into their practice, or can they just maybe have some kind of questionnaires, or just maybe even just some really detailed history intake to determine what the best nutritional advice would be for that individual?
It's a combination of things, but I'm in a jurisdiction where chiropractors can't order blood work. It doesn't mean that I can't get access to their blood work, or I can't give them a list of blood biomarkers I'd like them to have done by their physician in their next annual physical exam. And I sometimes will write a short note that they'll take to their doctor to explain why I want them. And in 90% of cases, the compliance is very high.
Right.
In this digital world, they can share that blood work with me, and I can see it. I don't need to order it. I can just say to them, here's what I'd like your doctor to order next time you see them.
Mm-hmm.
And here's why. Okay. And usually the doctor will say, yeah, that's a good idea. Let's get that done. And
so how would you go ahead and advise a chiropractor on how to learn about what blood disorders? Do you have a course that you teach on that, or?
I do. I have a course called biomarkers and longevity and disease prevention, where I explain the importance of each one of the key. It's not, it's not like outside the scope of it. The chiropractor should be learning this in school, first of all.
Yeah.
And even though I do teach it to students, or I did when I was teaching full time, when they get into the clinic, the clinicians don't hold them responsible for this kind of stuff. So they never actually do it when they're interns. So they don't get in the habit of doing it.
Right.
So then after they graduate, they have to come back and take my course. Where I said, now you realize how important this is to go. So what is that? What is that C-reactive protein? What is LDL? How does that happen? So I teach them the important biomarkers to prevent degenerative diseases, and then how nutrition and supplements factor into how you would address that to get them into the more ideal range.
Yeah. I want to kind of shift gears a little bit, because one of the big things that everyone's talking about right now are all these peptides, semaglutide, trizeptide for weight loss. I know they've been around for a while for diabetes, but now we're seeing them a lot more for weight loss. I think I know at least 10 or 15 people that are on them right now. I was just curious to get your take on them, what you thought about them, if you thought that they were safe, healthy, or if you thought maybe we just don't know enough about them yet.
It's disappointing that people don't have the willpower and the internal fortitude just to make healthy lifestyle decisions, not to go on a diet, but just to start eating in a more health-promoting way, exercising regularly, and getting to their ideal body weight in the way that nature intended for us to do it. Because being overweight is risky. But because a large percent of the population can't seem to do it, then, using these drugs, I guess it's an acceptable way because it does get their body fat down.
Yeah.
But it's also breaking down muscle mass and bone mass and connective tissue. And I think they're putting themselves at risk for age-related sarcopenia and osteoporosis. And, possibly they have some GI issues. A lot of people have nausea and vomiting, and they don't feel well. So it's not my first choice as to how I'd like people to proceed. And what you're seeing is that they're so effective, and it's just such an easy, fix, that all these sort of weight loss companies are all going out of business, from Weight Watchers to Nutrisystem, all these things we used to see all the time.
Right.
They've lost their audience.
Yeah.
I mean, I used to do a lot of, back in the day, I did a lot of nutrition and wellness counseling for overweight patients. I had a program that worked quite well, but the person had to do some work. They had to exercise every day and report back and change their diet, their behaviors. Getting adults to change any kind of behavior is not an easy thing, as you know.
That's true.
So I guess these drugs are here to stay, and let's see what happens in the long run. I don't know what the long-term outcomes are going to be, but
I know at least
challenges.
I know at least 3 people that have been taking it that have been in the hospital for pancreatitis.
Oh, because that is a risk factor.
Yeah, that's a risk factor.
They say it's only a very tiny percentage of people, but if you know 3 already, that speaks volumes.
Yeah, I know a lot of people that have been there. And if you talk to them, who was I talking to? They said that in one hospital, 80% of the people that were admitted to ICU had some kind of GI issue from these drugs. Yeah, that's common. Yeah. So, what I guess what it comes down to is what's more unhealthy, being obese or taking these drugs, and if the only way you can lose weight is with these drugs, if you don't have the willpower to do it yourself, then they're probably not bad in those cases. But I think we're seeing them a lot more now in people that just want to lose like 10 pounds, like they're not really obese, but they just want to get skinnier, for the beach, for the summer.
They're really exploiting it.
Yeah, they really are.
I think that, for the person who truly is overweight, I mean, if they want to use that to kickstart things, that's fine. But I still think there should be, and the recommendation is that they get some nutrition and wellness coaching, so that in the long term they can get off the drugs. And I would support.
Yeah, so using it kind of as an adjunct to a weight loss program.
Give them the excitement of losing some weight and say, here's how you can now maintain it and get further gains and improvement in your health. I've seen people have success doing that, actually.
Yeah. Well, it's interesting, but our time is about up. I appreciate all the great information today, and I'd love to have you back sometime. Hopefully you can join us again in one of these podcasts. We'll have a different topic, of course, but thanks again for all the information, Doc. We appreciate it.
I appreciate you asking me. Great to see you, Doc. Thanks very much.
Take care.
Bye.
Thanks for joining us on DC Hours. If you enjoyed this episode, be sure to subscribe and leave a review. To explore online courses, seminars, and continuing education opportunities, visit dchours.com. Stay inspired, stay informed, and keep advancing your practice with DC Hours.